Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye.
Hello. Today I'd like to discuss the role of YUTIQ in treating a case of Irvine gas syndrome with chronic posterior uveitis. This is a 75-year-old woman who presented with eyelid swelling, redness, foreign body sensation associated with decreased and blurred vision that was recurrent over the past 3.5 years despite multiple previous treatments. She had a past ocular history significant for retinal tear status post laser retinopexy, as well as a subsequent vitrectomy with a membrane peel and recurrent iritis and posterior uveitis with associated cystoid macular edema in both the right and left eyes for many years. The previous treatments for these ocular complaints included topical corticosteroid and non-steroidal anti-inflammatory eye drops without improvement. She also had a previous intravitreal steroid injection as well as multiple short-duration intravitreal corticosteroid implants. Although she did experience some improvement for 6 to 14 weeks after each intravitreal injection, the symptoms of blurry vision and loss of visual acuity always recurred. When she presented for consideration of a YUTIQ injection, her best corrected vision was 20/70 with normal intraocular pressure in the right eye. Anterior chamber findings were significant for 2+ cell in the presence of a posterior chamber intraocular lens. She had trace vitreous cell as well as cystoid macular edema seen on both indirect exam and OCT testing. Fluorescein angiography also confirmed the presence of mild macular and disc leakage in the right eye. At this time, the patient was diagnosed with Irvine gas syndrome or postoperative chronic posterior uveitis with associated cystoid macular edema in the right eye, and the decision was confirmed to treat her with a YUTIQ implant. She subsequently presented at 1 month and 5 months with total resolution of her symptoms. Best corrected vision on her most recent visit was 20/25 with normal intraocular pressures and a deep and quiet anterior chamber in her right eye. Dilated exam and OCT testing showed complete resolution of the cystoid macular edema. Thus, we have presented a case of chronic posterior uveitis in the setting of Irvine gas syndrome in a patient who had had multiple prior retinal and intraocular procedures. This case showed successful resolution of all posterior uveitis with associated cystoid macular edema after treatment with a fluocinolone acetonide intravitreal implant, YUTIQ. I will continue to monitor the patient for inflammation and changes in IOP, and if either occurs, I will treat appropriately. Thank you very much.
Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 mg is indicated for the treatment of chronic non-infectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.